So this is my patient, John, and I'm going to let him do all the talking in just a second, but I'm going to give everyone a little background here. John had surgery just 2 weeks ago. It's like the other patient we just did a Facebook Live with, but he had an unusual problem. That's why I'm putting him on today. He had a disc problem higher up in the lumbar spine where the spinal cord is. And in fact, sometimes in these cases, there's a published study, and John and I talked about this before the surgery. I probably stressed him out, showing that 50% of patients can actually be worse after surgery if the spinal cord gets injured in the effort to decompress it. In other words, think of it this way. The spinal cord's being squeezed so hard, and to get in there and to get her move around it and work around it, sometimes you put pressure on it with the instruments that you use that can actually injure the nerves. So we did a little bit different procedure after I talked to a good friend of mine named Dr. Ahmed. We discussed his case and decided that we would go from a slightly different approach to a facetectomy and avoiding the cord altogether, which means we kind of approached him from the side. Anyway, the point is, all's well that ends well. It's a dangerous surgery that could have left him in a wheelchair, more so than some other surgeries, but instead the opposite happened, and he hasn't had any pain. He's going to tell you all this. He isn't even really taking much pain medication. He has no weakness whatsoever, and he's walking around feeling great, I think is what you just told me, John. Go ahead.
Yeah, I'm John, and had my surgery on the 13th of May. First couple days, little sore. Got home on the 14th. By Saturday, Sunday, I was walking around my house. I was doing chores in my home. I'm a single father, and I don't need this. I don't need this. The cane. I can bend. I can do a lot of things that normally, like Dr. Sani said, nobody would do, or I'd be in a wheelchair, and I'm not. And I'm doing great. I'm driving. I drove here today. Been driving since Monday, and feel great.
Can I show him your little incision? Do you mind?
Sure.
So he's a little higher up on his back, closer to the spinal cord, but that's it. I mean, this is, just so you know, that's my thumbnail. So we're not talking about a real big incision, and he's healed up fantastic. So it's a little red because we just pulled off the bandage, and there's a little wet under the bandage because he's sweating a little bit, but that's all going to dry up probably in a few hours, and he's going to do great. But I just was happy. I am so happy.
So am I.
That this worked out this way.
I love it.
And you said you haven't really been taking pain pills.
I took 2 in the hospital because they gave them to me, of course, right after surgery. And then I told them to stop. I got home. I filled the prescription that you guys gave me for the muscle relaxers. I took 1 that night. I haven't touched them since. They're still sitting on my table next to my chair.
Good.
Haven't touched nothing.
Nurses at the hospital were nice.
Oh, they were fabulous.
Good. Hospital was nice. Clean hospital.
Oh, that's where I want to go from now, all of my surgeries.
Yeah, nice view. Did you get a view of the golf course?
Oh yeah.
Yeah.
It was.
He left so early the next morning, though. You didn't get a chance to enjoy it.
A chance to enjoy it. Yes, yeah, Chris
As
just.
soon as he came in, it was like, "Can I go home?" He was like,
Well, you actually, I kept you overnight because I was worried about the area that we're operating on. I was
Yeah.
nervous about it.
Yeah.
But if you remember correctly, or I remember anyway, I came to see you when I finished my other surgeries that day, and you're like,
Yeah.
dude, I'm ready to go home now. I just don't have a ride. If I could, I was like, yeah, let's keep you anyway and make sure, everything's good.
Yeah, everything went great. I can't wait for to see what else is wrong with me. So you can.
And you would have it again.
See this arm right here? I wasn't able to do this like this. I wasn't able to do this for 20 years.
Wow.
After surgery, I could actually scratch my back now. I couldn't do that before.
Because of pain in your back?
Yeah.
Okay.
Because I can get to here, but that was as far as it goes, and then it started hurting. But now I go all the way across, both hands, nothing.
And how long?
I can actually bring my knees up.
Oh, wow.
Higher than I've ever done before.
And this is 2 weeks after surgery, guys.
Yeah.
So amazing. And which leg was it again? It's the left leg,
It was the
right?
left
Yeah,
leg.
it's the left leg that was getting you the most.
Yeah.
And how long had you been using that cane?
The cane, just to come and mess with you guys.
Okay. Oh, just to come and mess with us, guys?
And then this, just to mess with y'all. But other than that, I haven't needed it. I haven't needed it at all.
All right. Rockin' John. Rockin' John. Well, definitely glad we did your surgery. Definitely
So
glad
glad.
the horrible things that I told you could have happened, none of them happened.
Yeah.
I think you lost about a tablespoon of blood. I think that was you. Definitely didn't lose much more than that.
That's all you said.
Yeah, about a tablespoon of blood, if I remember correctly. And everything went really smooth. So everybody's happy.
That's right. I'm ecstatic.
All right, man. So thumbs up for Spine Center?
Thumbs up, big time, 100%. Make it 1,000. It works.
Awesome.